Okay, so we will be looking at some of the important questions of anesthesia, and these are CSF is located in which space relevant to spinal anesthesia? It is located into subarachnoid space. So CSF is drained into subarachnoid space in spinal anesthesia, and direct access to spinal cord is rapid, profound, and which of the following is first sign of high spinal block? First sign is hypotension. Patient will develop hypotension, and it is first sign. A high spinal block leads to sympathetic blockage, results into vasodilation and sudden hypotension as a first clinical sign. Next one is which landmark commonly used to identify L3 L4 intercostal spinal anesthesia? That is iliac crest. Iliac crest is a landmark to determine L3 and L4 level for spinal anesthesia. Next one is pencil point spinal needle is designed to reduce the incidence of hypertension, post anesthetic hypertension. Pencil point non-cutting needles are wide care, sporty, reduce trauma of dura, and it lowers the risk of post-dural puncture headache. Which of the following is relative contraindication to spinal anesthesia? And that contraindication is chronic back pain is not an absolute contraindication. Absolute contraindications are if patient is refusing, or severe hypovolemia is there, or any infection at the site. These are some contraindications, while chronic back pain is not a contraindication and it requires caution. Absolute contraindications are these: which structure must be pierced last during subarachnoid space? That is dura mater should be pierced in the last, while uh, spinal tap. What is the typical volume of local anesthetic in spinal anesthesia? Typical volume of local anesthetic is 1.3 to 1.5 to 3 ml is the typical. Okay, next one is which of the following is most dangerous complication of spinal anesthesia? Dangerous complication of spinal anesthesia is a total spinal blockage results into anesthetic spread too high, affecting the brainstem and can cause respiratory arrest, bradycardia, and unconsciousness. It is the most dangerous complication of spinal anesthesia, means total spinal blockage in which there is anesthetic spreads too high, affecting brainstem, bradycardia, unconsciousness, and the respiratory system is involved in this condition. Next is which why is preloading with IV fluids recommended before spinal anesthesia? Preloading with IV fluid is recommended to prevent hypotension. We have to give IV preloading fluids. If there is chest infection, we have to use antibiotics and steroids to maintain chest infection and congestion. In pregnancy, in pregnant women, next one is in pregnant women, spinal anesthetic required to reduce because of compression of inferior vena cava, reduce CSF space. So the answer is compression of inferior vena cava to reduce CSF space, and the engorged epidural vein, uterine compression of the IVC inferior vena cava reduce CSF volume, and the lower dose is needed. So these are some of the important questions that are very important for spinal and general anesthesia, which you have to memorize. And